kids are better than adults. The joy of children, the pureness of children, the naivety of children, the kindness of children. And I realized that this is what I want actually. So I myself was a student of DBMCI. Back in my internship in 2017, I had joined the test and discussion of DBMCI. So when I was given the opportunity to teach at DBMCI, it was a no-brainer. You are going to contribute to a platform that helped in your own success. I don't think so there's anything better than this. So I've taught pediatrics at DBMCI One in a fun and playful manner. I know that you guys are students. And I've used instances from my own student life so that you can actually relate to these lectures. I've used multiple clinical scenarios and clinical examples from that. Because we know nowadays papers are more clinical based. That okay, this is how the clinical scenario and how the patient is going to present, or how the baby is going to present, or the newborn is going to present. One another edge that you'll have watching my lectures, being at AIIMS for the past 12 years has given me a different picture, or a unique perspective I would like to say, that gets me an insight how they actually frame questions. The first example is Edward and Patau. It's one thing to teach Edward and Patau in a proper didactic manner, like I told you. These are the features of Edward, these are features of Patau. I made a tabulated table, table highlighting the differences between Edward and Patau. So okay, this is the thing that you have to focus upon. Okay, cleft palate is coming, Patau. Okay, holoprosen kefli is coming, Patau. Rockabout feet is coming, Edward. So you understand the differences and able to solve the MCQs. So in essence, learning pediatrics from me and my lectures at DBMCI One, you'll get a fun and enjoyable experience, an experience filled with anecdotes and experiences from my residency, clinical correlates that help you understand better, an insight into exam preparation and how to solve MCQs rather than just answering them, and also an insight into what is important and what's not important. Hi, I'm Dr. Aditya Sanjay Gupta, your pediatrics faculty at DBMCI One.